93% of rheumatoid arthritis patients are vitamin D deficient. But here's what they won't tell you. Standard supplements rarely work. Why? Because the disease itself breaks your vitamin D metabolism. 10 years. That's how long RA is developing before you get diagnosed. It starts in your gut, progresses through your thyroid, and only then attacks your joints. In India, during viral season, 60 to 70% of new RA cases are post-chikungunya. And if you don't catch it early, it becomes permanent autoimmune disease. Your rheumatologist says your vitamin D is normal at 35 nanograms per milliliter. Our clinical data shows you need 120 to 180 to achieve remission. Not improvement, remission. We've seen patients spend years on homeopathy and Ayurveda. Zero erosion prevention. Zero antibody reduction. We'll show you exactly why these approaches fail at the biochemical level. Our protocol, 97% remission rate within 3 to 5 months. We start tapering biologics at day 25. Complete discontinuation by day 60 in most cases. And here's the secret we'll reveal at the end. Rheumatoid arthritis is actually the easiest autoimmune condition to bring to sustained remission. This started in 2017 when 2 doctors couldn't even help themselves. 10 painkillers a day, zero relief. 45 minutes just to get out of bed. Then one conversation in Spain changed everything. The next 70 minutes will give you the complete scientific truth about rheumatoid arthritis that no single specialist will ever explain. Because no single specialist sees the full timeline. Let's begin. We need to show you something that conventional rheumatology consistently misses. Not because rheumatologists are incompetent, but because they're looking at the wrong timeline. Here's what we see when a patient walks into our clinic with newly diagnosed rheumatoid arthritis. Their rheumatologist diagnosed them 6 months ago, started methotrexate, added folic acid, ordered labs every 6 weeks. Standard protocol. But when we take a detailed history, something emerges. 10 years ago, they started having severe acid reflux. Multiple courses of proton pump inhibitors. Told it's just GERD. 8 years ago, they developed chronic fatigue. Thyroid panel ordered. TSH came back 3.8 milliIU per liter. Normal. Nothing to worry about. 6 years ago, recurrent fungal infections. Scalp psoriasis. Treated with topical steroids. Use this cream when it flares. 4 years ago, severe viral fever. Later confirmed as chikungunya. Joint pain persisted for months. Post-viral arthritis. It will resolve. 2 years ago, they started having morning stiffness in hands. Mild at first, dismissed as aging or overuse. 1 year ago, multiple small joints involved. Anti-CCP positive, RF positive, ESR 62 millimeters per hour, CRP 8.4 milligrams per liter. Diagnosis? Rheumatoid arthritis. Now here's the question no one asked. Did rheumatoid arthritis start 1 year ago when the antibodies appeared? Or did it start 10 years ago when the gut inflammation began? Here's the uncomfortable truth that will reframe everything you understand about RA. Rheumatoid arthritis is not a disease that suddenly appears. It is the final manifestation of a decade-long process of immune dysregulation that begins in the gut, progresses through the skin and thyroid, and ultimately targets the joints. The antibodies that conventional medicine uses to diagnose RA, those appear years after the autoimmune process has already started. By the time you're diagnosed with RA, your immune system has been dysfunctional for an average of 7 to 12 years. Today, we're going to give you the complete story of rheumatoid arthritis that no single specialist will ever explain, because no single specialist sees the full timeline. We'll start with what RA actually is at the molecular level. Not the textbook definition, but the cellular reality. Then we'll trace backwards through the etiology, the true timeline of how RA develops over years or decades before diagnosis. We'll dissect the blood work that conventional rheumatology orders and show you what they're missing. The thyroid dysfunction they ignore, the iron deficiency they attribute to inflammation, the metabolic markers they never check. We'll explain the different types of RA most patients never hear about, seropositive versus seronegative, post-viral RA after chikungunya or dengue, drug-induced RA, and the patterns that determine prognosis. We'll analyze conventional treatment, DMARDs, biologics, JAK inhibitors, what they do, what they don't do, why they work for some and fail for others. We'll address why other approaches like homeopathy and Ayurveda fail to achieve lasting immunomodulation. And finally, we'll explain our integrative approach, how we address the metabolic dysfunction, restore immune regulation through vitamin D and cofactors therapy, clear underlying infections, and achieve remission rates that conventional rheumatology considers impossible. This is not a 10-minute overview. This is the complete scientific masterclass. If you're a patient with RA, this will change how you think about your disease. If you're a doctor, this will challenge everything you learned in medical school about autoimmune disease. Let's begin. In the next part, we go inside the joints. You'll understand exactly what is happening in your synovium, why your immune system is attacking itself, and why the inflammation that wakes you up at 4 in the morning peaks at exactly that hour. Not randomly, not by coincidence, exactly that hour. And if you want the complete picture, the full 2-hour RA masterclass is linked in the description below and pinned in the comments.